prospective egg donors. Today we'll be discussing, is egg donation painful? This is a very common question that we get from prospective egg donors. So who better else to answer these questions are former egg donors. Before we get started, we're just going to do a bit of housekeeping. You can listen in by phone or using your computer speakers. Everyone who's in attendance is on mute. However, if you have questions, you can use the questions panel on the right. We'll give you an opportunity throughout so you can type any questions you have, and at the end, we'll be sure to answer them. On today's webinar, we have two panelists. The first is Gina Marie Mariano Mato. She is a Circle egg donation attorney and a previous egg donor herself. And we also have Bria Sullivan, an experienced egg donor with Circle. Both are very excited to be here and very excited to share their experiences on a topic that's not really discussed too much and should be. What we'll cover today in the webinar, basically what is egg donation, just to give you guys a bit of an overview of the process, the basic requirements for egg donor applicants, and then the bulk of this will be about medications, injections, egg retrieval, recovery, and then obviously compensation is a big part of this, so we'll hit on that point as well. I'm going to turn this over to Gina Marie. Welcome, Gina Marie.
Hi everyone, I'm really excited to be here tonight. I'm Gina Marie, as Kayla said, and the first thing we want to discuss is what is egg donation. Egg donation is the process by which a woman donates her eggs for the purpose of assisted reproduction to help hopeful intended parents have a child. The basic requirements for being an egg donor are you must be generally healthy between the ages of 20 and 29, BMI lower than 28, no more than one occurrence of the same cancer in your family history, no serious heart disease or heart attacks under age 55, no psychiatric hospitalizations, you must be a U.S. citizen, you must have a minimum of a high school degree or GED, and you must most importantly be comfortable with giving yourself daily injections. The next thing we want to discuss are the physical aspects of egg donation. This includes hormone injections, blood work and a vaginal ultrasound, and the egg retrieval and recovery. The next thing we want to get into are injections. So typically the timeline for injections is a 21-day medication regimen. Sometimes you'll take 1 injection per day, sometimes 2, and you could take upwards of 3 injections per day. The injections are typically done in your lower abdomen, upper thigh, or your buttocks. You'll want to ask the nurse which spot you'll want to do the injections in. Sometimes you'll want to rotate different areas too so you're not as sore from the injections. The size of the needle is about 1/2 inch, pretty small, the same size that a diabetic would use to prick their finger. The pain level, it's different for everybody. Everybody's body responds differently to the medications, and everyone feels differently when they're taking the injection. For me, they vary from feeling like a pinprick to some slight burning or tingling at the injection site. And when that happened for me, I just iced the injection site prior to doing the injection, and then it didn't really feel like any burning or tingling. Bria, how did you feel about the injections?
Hi, everybody. When I was taking injections, I think in the beginning it was pretty painless. It was almost surprising when you did it. It was like, okay, well, that was it. All right. But towards the end, it kind of got to the point where, you know, if I would give myself an injection, sometimes I would get that dull ache that you get when someone is like taking your blood or giving you an injection if you've ever taken, you know, antibiotics, something like that. So I just got that sort of like bruise-like dull ache while it was going in, and then when it came out, it was just kind of like I just rubbed it away, and it went away in about 5–10 minutes.
Did you feel like rotating the injection site like helped? Because when I did it, I would do the injection one on like the right side of my lower abdomen, and then the next day would do it on the left side, just so I wasn't always injecting it at the same spot.
Yeah, I did the same thing. I think the first couple of days that I did it, I was like, why is this hurting? Well, maybe I should switch. And so I started switching, and I started doing it in different places. And that did the trick.
Perfect. Okay, so the next thing that we want to talk about are blood work and vaginal ultrasound. So as a donor, you will have appointments at the IVF clinic every few days to test your hormone levels, how your body is responding to the medications, how many follicles you're growing, and what size they're at. So with the blood work and a vaginal ultrasound, it's not really painful. The blood work is just a simple pinprick right in your arm, and if you're able to donate blood, it's pretty much the same thing. Now with the vaginal ultrasound, by definition, that's something that's invasive because it involves an ultrasound wand being inserted through the vagina to basically poke around and see, how things are going, how your follicles are growing, how the procedure is progressing. It's not painful, but you can definitely feel pressure. When I was having the ultrasound done and the ultrasound tech said, okay, I'm going to check the left side of your ovaries, I could definitely tell that the ultrasound wand was veering over to the left side of my body. Bria, how did you feel with the blood work and the ultrasound?
Blood work was really nothing more than just drawing blood and just that dull ache sometimes, but not every time. When it came to the ultrasound, in the beginning part of my cycle, it was, pretty painless. It was almost just like a routine kind of physical, woman's physical. But towards the end, when, your follicles started to produce more eggs, I could definitely feel, like you said, where the wand was going. And it was actually a really interesting experience, though, because it wasn't that it was painful. It was more just like I suddenly was very well aware from an internal perspective where my ovaries were. When, you kind of know where they are from anatomy class, but you don't really know, and you can't exactly point to them until you've had this experience. So it was really fascinating to see it on the screen and to know, hey, that's my body. That's what it looks like, and this is where my ovaries are. And other than close to the end of the procedure, or to the end of the cycle, that's the only time when it was slightly uncomfortable.
Yeah, I would definitely agree with that. I mean, before becoming an egg donor, as a woman, you know where all of your reproductive organs are, but once you go through the donation process and you're taking the hormone injections, you are acutely aware that they are definitely in this particular spot. And I remember towards the end of the cycle, feeling a bit bloated, feeling, like I could feel my ovaries inside of me. And when I would go to the bathroom, it felt like I did a serious ab workout when really I hadn't done anything. So you could definitely feel the pressure, and you could tell exactly, where your ovaries are. So I think that it was interesting in terms of awareness as a female about, where everything is in my body and how everything feels.
Absolutely. It was very, very interesting, and it's stuck with me for forever.
Yeah, definitely. Okay, so the next thing we want to talk about is the egg retrieval and the recovery. So the procedure itself takes about 15 to 25 minutes. You will be under general anesthesia. The procedure itself is not painful. You're under anesthesia, you don't feel a thing. When you wake up, that's when it's a little bit different. When I woke up, I felt like a dulled pain in my lower abdomen. I woke up and had a heating pad. Most importantly about waking up, I had a support person with me. At the time, it was my boyfriend, who is my now husband. He was there with me in the recovery room. And it's important for you to have a support person be with you because you will be under anesthesia. Someone does need to stay with you for at least 24 hours. Someone is going to need to drive you home. You shouldn't be completely by yourself. Post-retrieval and in terms of recovery, so for everybody, it's different. You should expect bloating. You should expect cramping. For me, about 1 week post-retrieval, I felt normal. And about 2 weeks post-retrieval, after my period came back, I felt 150% absolutely back to normal. I would recommend taking it easy post-retrieval, but not something like you need to be on bed rest or anything like that. For me, I went to work the next day, and part of that was because, I just thought I'm super G. I can do anything. I'm going to go through the retrieval, and then I'm going to go back to work the next day, and it's going to be no problem. I have an office job, so it really wasn't a problem for me to sit at my desk for the day. But when I had to walk to the train to get to work, it definitely, I took teeny tiny little steps, and there was always this dull sense of pain in my lower abdomen. But I was given pain medication so that it really wasn't unbearable for me. Depending on what your job is, you may be able to go right back to work, or you may need a couple of days to take it easy, a little bit of recovery. But again, nothing so extensive that you really need to be on bed rest. Something that I think is really important is staying hydrated during your cycle and post-cycle with electrolytes, lots of Gatorade. This will help prevent ovarian hyperstimulation, and keep in mind that you will have pain medications post-retrieval. Something else to be aware of is you'll be bloated post-procedure, and the pain medication can sometimes make you constipated, and constipation can just lead to excess bloating. So if you're wondering, how do you take down the extra bloat, one of the nurses had recommended to me milk of magnesium and also high-fiber fruits, just to kind of get everything moving so that you feel back to normal as soon as possible. Bria, can you share with us about how the retrieval and recovery was for you?
Yeah, so I did 2 egg donations. The first one, I was working as a waitress, so I was on my feet a lot. I was riding my bike to school or walking to college. So I had a very, very active lifestyle, and I was on my feet all the time. So my first time doing it, I just figured I'm a very strong person, so I bounced back really quickly from everything. Mm-hmm. So I did my retrieval, and I took, I think, a day off or 2 days off, and then I went back to work like nothing had happened, and I was, of course, waitressing. And for those who work on their feet, you might not notice it while you're doing it in your, going through your normal life, but when you walk around a lot in the course of a day, when your ovaries are, they're producing lots of eggs, what it feels like inside of you is like 2 like tennis balls or ping pong balls or something. That
you can definitely something there, right?
Yeah, you feel like they're bigger. Like you notice that, and they are. You notice that they're there. But when you walk,
well, to the touch, right? Like if you were to touch your lower abdomen on the right and left side, like you could really feel like, okay, if somebody did an X-ray of my body right now, like this is definitely where my ovaries would be.
Yes, like you could touch it and feel it, and you're like, yep, this is where they are. No more mystery anymore. And that's the thing is, I think my experience from that is when I would walk, it would feel like they would jiggle, and I don't know if they actually do in real life, but that's what it felt like was happening.
It's kind of a vibrating sensation, like you just were aware, like, okay, with each step things are moving around a little bit differently, and it's more just the awareness of where everything is in your body. When you're not a donor, you know where your ovaries are, but you never think of them. You never feel them, and when you go through the donation process, you learn more about your body, and you are aware, like, this is definitely where everything is.
Yeah, and so when they were moving around like that, it was making things a little bit more uncomfortable. So the first time I had done it, I was taking, for the dorks out there, marching band steps, which involves like a heel-to-toe roll that you just do over and over so that you're not jumping up and down or jiggling your instrument too much. Well, that's what I was doing to kind of mitigate the discomfort, and I just didn't like the experience of working on my feet and having to recover from just the soreness of the whole process. So the second time I did it, I remembered how foolish it was for my body and myself to do that. So the second time around, I decided to take the good week to take it easy and not try to work too much and take, a lot more care with myself and just be good to myself and be kind on my body and not run around on my feet. So I wasn't, on bed rest or anything, but I was definitely sitting down much more than I was.
Yeah, and I would have to agree with that. I did the same thing. You don't know the first time that you're a donor, and there was no webinar like this or anything else really saying, is egg donation painful? What is it really going to be like. And with my second, third, and fourth donations, each time after, instead of walking to the train to get to work, I had asked, can I work from home those days? It'll be easier for me to just hang around the house instead of having to walk a mile to the train to get to the office. So I think that with each donation, I felt I was more aware of my own body. I knew what the process was going to be like, and it allowed me to rearrange my schedule so that I could accommodate doing the donation.
Well, and I think most importantly is that I think you would agree, but it takes about 7 days, like almost to the day.
A full week.
Better. Yeah, it takes a whole week to really feel like you're back to your old self. And I think now, for those that are getting to watch the webinar, I think they're hearing us in our first time experience. They're hearing it. So, just know that probably you don't want to walk around and run a mile and go jogging.
Right. Take it easy a little bit. And did you feel that once your period came, about 2 weeks post-retrieval, that you really felt 150% back to normal?
Yeah, definitely even by the 7th day, I was like, oh,
days is really
back.
Good.
And then definitely better. It's kind of like the first day you get your period, you really don't want to do that much. You kind of want to
a little crampy, unmotivated. You just kind of want to take it easy.
Yeah, and you might be a little emotional, so you want to just take a day to kind of like be good to yourself. Well, it's sort of like that. So you just want to be kind. That's sort of the purpose.
Relax, watch some TV, take it easy.
Yeah.
Okay, great. So the next thing we want to talk about is compensation for donors. So Circle Egg Donation is an ASRM approved agency. The ASRM is the American Society for Reproductive Medicine, and they give guidelines for appropriate compensation for donors. And that range is $5,000 to $10,000. First-time donors at Circle receive $8,000. Second-time donors receive $9,000. And for 3 or more donations, the donor will receive $10,000. Okay, why did I donate my eggs, and what did I get from the experience? So I personally donated my eggs after I started working at Circle. I really liked all of the work that I was doing here. I really liked what I was able to see from the intended parents, how happy they were, and I got to see firsthand experience from donors going through the process, and I saw that the process was, for the most part, pretty smooth, streamlined, and I thought, I really want to be a part of that. I want to help somebody. I want to give somebody this wonderful gift. And what did I get from the experience? I got more than I really ever thought I could get. I did known, semi-known, and anonymous donations. And in my known donations, I'm fortunate enough to have pictures of some of the children. There are 5 donor-conceived children born from my donations. And it was really special for me to get to know the parents, see what wonderful people they are, and more importantly, to see how happy that their children are with them. It's just a really joyful experience for me. Bria, why did you donate?
I donated because I had encountered a girl that I was working with at the Top of the Hub restaurant in Boston, and she was actually working with I think Circle at the time, and I was watching her give herself injections and whatnot, in the locker room, and I was asking her what she was doing, was she diabetic? And she said, no, I'm donating my eggs to, a family friend of mine who can't have their own children. And I was like, I'm sorry, what? And I just, pressed her for information, and she, for about two months, I think I just talked with her every day about what her experience was like and why she was doing it, and what she thought about the future of that, and how she could conceive of a child potentially being born that would look like her, or would just exist in the world because of her, that she wasn't going to mother. And the whole process just absolutely fascinated me, and I thought it was so interesting and something that I had never even heard about or imagined was even possible. So I did a lot of research, and I did a lot of research for about a year before really calling Circle and kind of getting the whole process going. And I think in the end, my experience with it was, part of it is, of course, I enjoy the compensation. That definitely helped my life as well. But a lot of it was the sheer fascination of being part of something that hasn't existed for many, many years. It's something that I don't think women could have even conceived of before, years and years and years and decades and centuries before. It's just fascinating to me, the whole process. And, I've had 2 donations, and one is semi-known and the other is known, and they have, become a very big part of my life. And I've actually met one of the children that resulted from a donation, and it is a feeling and experience that I hope everyone gets to experience that goes through this, because it's unmatched. There's nothing in the world that can compare to seeing, a child that you help bring into the world, or meet that child, and then be able to have your life be improved by it, and the life of the parents and the life of the child, to be with somebody who goes through so much just to have that child. It is a life-changing experience, and the best one. It's still, to this day, the thing that I've done with my life that I'm most proud of.
I would have to agree with you there. I would definitely say it's one of the things I'm most proud of in my life. And what was really something that recently happened to me, one of the intended parents that I donated to, who didn't want to have a known relationship with me, has opened up to me now, and it's actually asked to meet me. And it's something that I'm really excited about doing. I'm going to meet the mom first, and then possibly one day we'll get to meet her twin boys and her husband as well. And it's almost an indescribable experience. You almost have to be in it yourself to really understand, but I just feel so happy that I was able to give this gift to someone. And, when you talked earlier about, well, compensation was, of course, nice. When I think back about that, I think about I used my compensation to help put me through law school. And the intended parents, of course, used the compensation that they gave me to create their children. And when I really look at it, what we both did there was we helped each other achieve our lifelong dreams. It has been my lifelong dream to go to law school, to take and pass the bar, to become an attorney, and it was their lifelong dream to create a family. So by coming together and doing this, we really helped each other achieve our lifelong dreams.
Yeah, that's beautifully said, I have to say. And when you meet the child or the children someday, from my perspective of having met that child, it's the kid is, 5 years old or 3 years old or a baby, and the baby's not going to have any idea how incredibly special that person is. And I look at, a 5-year-old and I say, thank you for changing my life. Like, you made my dream.
Isn't that so weird to say, like, you look at a little kid and said, you made my whole life more than I ever could have imagined that it would be.
It's like, it's untouchable. It's just the most emotional feeling that you can get, that it's more of a joyous, emotional feeling that doesn't have any English words yet to describe.
Yeah, I think we're both just very lucky. We both feel very lucky to be egg donors, and to, more importantly, be known egg donors, where you get to really be involved in the process at another level.
Yes, it makes all the difference.
Okay, so the next thing, so before we move on to questions, what I definitely wanted to say is, despite the pain and the discomfort that we've talked about, that goes along with being an egg donor, it's totally worth it. I remember at my last donation, my IPs kept asking, are you okay? We hope you're not in a lot of pain. And I remember joking and saying with them, no pain, no gain. I was aware of what I was getting into. I knew that there was going to be some pain and discomfort, but knowing what to expect and being aware of your body and what you're doing is the most important, and is what will really help you have a successful retrieval. So what you should take away from this webinar is we want you to be aware of there is some pain and some discomfort, but it's not something that should be a deterrent to becoming an egg donor. It's something you should be aware about so you can make an informed decision. But really, overall, what Bree and I are trying to impress upon you is that there is nothing more beautiful or joyful than becoming an egg donor. So now we wanted to turn it over to any questions that you have.
So we did get one question. The question is, you have to travel to the IVF centers for the monitoring?
So you will have to travel to the IVF clinic. There are a couple of times. The first trip you'll need to go to is for the medical screening. That trip is typically a 1 to 2 day appointment, depending on the timing of the appointments. The next time you will have to go to the retrieval or to the IVF clinic is for the retrieval. That trip could be as short as 2 days. It could be as long as 10 days. It depends on how your body responds to the medications. If you are more of a slow responder, be closer to 10 days. If you are a faster responder, it'll be close to 2 to 4 days. When you are on medications for the cycle, when we talked about the blood work and the vaginal ultrasound, if you are local to the IVF clinic, within about an hour's drive or so, you'll go directly to the IVF clinic. However, if the IVF clinic is across the country, you'll go to a local monitoring clinic for that, somewhere within about an hour or so's drive of your home, so that you don't have to go directly to the IVF clinic for all of the appointments. But of course, the test will be ordered by the IVF physician and it will be reviewed by the IVF physician. It'll just depend on your exact location.
Great. And does the donor actually, this is a question for me, does the donor have to pay for the travel?
No, donor does not pay for anything. The intended parents cover all expenses, all travel, all lodging, and you are also given a daily stipend of $100 to cover any food.
Great, excellent. Okay, so I think at this point we're going to wrap up. If anyone has any questions about the process, please email Franny at fmcbrien@circleeggdonation.com. You can also apply at circleeggdonation.com/donors. There's a wealth of information, frequently asked questions, requirements. We want you to be as well educated as possible about the process before you apply, so you feel comfortable about the process. Thank you for attending. This is wonderful. Thank you, Bria, and thank you, Gina Marie.
Happy to be here. Thanks all to everyone for coming.
Yeah, thank you very much for inviting me.
Great, and I will be emailing everyone who attended the webinar. All right, have a great night, everyone. Bye-bye.